Today is November 27th, 2024, and my guest is author, economist, and now podcaster Emily Oster of Brown University. Her podcast is Raising Parents, great title. This is Emily's sixth appearance on EconTalk. She was last year in November of 2021 talking about the family firm. Our topic for today is public health, how the experts talk about it. Our conversation will be based on a recent audio essay you did, Emily, for the New York Times on public health messaging, making the case bravely for Nuance. We'll also talk about some of the health issues in the air as we approach the second Trump administration. We'll probably get into some other topics as well. Emily, welcome back to EconTalk.
For having me. I always love to talk to you.
Ditto. Talked about the incoming Trump administration. We're recording this. I just want to let listeners know, remind listeners, this is November of 2024. This will come out sometime probably in December. The world may have changed, but it will still have issues that are the same as these, even if some people who might talk about them are not the same. In particular, you talked in your piece at the Times about three issues that have been discussed recently and championed that conversation by Robert F. Kennedy Jr., who's been nominated by President-elect Trump to be Secretary of Health and Human Services. And I love this piece because, first of all, these three issues are often lumped together as if they're all the same. What's beautiful about them is they all illustrate something slightly different. Those three issues are measles vaccines, raw milk, and fluoride, fluoridating the water. Let's take them one at a time. So let's talk about measles and maybe vaccines in general.
I mean, when you look at the landscape of information about vaccines, there's a tremendous amount of information suggesting safety and efficacy of childhood vaccinations, which is what we're talking about with measles. The measles vaccine in particular has been around for many, many decades, has saved literally millions of lives. I think it's easy to forget that things like measles and pertussis and the basic stuff we vaccinate kids for, they kill a lot of people. They still kill a lot of people, and they certainly killed a lot of people before vaccines. And this is a space where it's both. We have a lot of evidence of safety. There's a lot of reason to think that high vaccination rates are important. So measles is actually something that lives on surfaces. And so it is really, really contagious. You need a very high vaccination rate to generate herd immunity, but the vaccine itself is incredibly protective. So it's really a very good vaccine. And then we have this sort of basic misinformation about links between, say, the measles vaccine and autism, which it's not just like, well, different people could see things differently. It's like the evidence on which that idea is based was literally made up. Like it's made up. Somebody made it up in the service of, money, basically. And we can talk more about that if you want. But that the study that sort of initially linked those, it was just not correct. And there's tons of data after that from large scale data sets that show that there's no link there. So that this is a place where I think that the evidence on both benefits and the evidence on risks is really clear that vaccination for measles and for pertussis and from these early childhood vaccines are a really good idea. Full stop.
Yeah, I'm older than you. I had measles. I think I did. We called it measles. It's not a technical term, but I don't think we had the vaccine in 1955. But we'll let listeners weigh in on that if they want, who have access to like a search engine or something. But the bottom line is it's a relatively recent thing. It's a tremendous human achievement in my view. And of course, it's no medical intervention is free. All of them have a risk of other effects that we don't intend. And it's really a question of how likely those effects are. And your point here is that the effects are very small, and in the case of autism, probably non-existent. There may be other issues that come from the vaccine, but that's not the one that we should ever think about. And whatever those issues are, they're small. Agreed?
Great. Yeah, absolutely. I think it's again, sort of, if we're in the space of nuance, I think it's important that we not say, no one has ever do a vaccine, or that, your child isn't going to get a fever. Many kids do get a fever about 10 days after the measles vaccine. That is a very common side effect. So I think we don't want to pretend that literally there could never be any, that there are no possible side effects of something, because that's not true. And because then people don't trust you. But at the same time, I think we need to give the message that, like, those side effects are small, they are limited. The things that you're worried about, like big picture, like that's not supported in the data. And there's a lot of reason why you should want your kid to have this vaccine so they don't get the measles, which you may well have had in 1955. The measles vaccine is from the 60s.
There we go. Okay. I had them all. I had mumps. It was such an exciting time. I would remind listeners that I interviewed Brian Deere on this issue of autism and vaccination and scientific fraud. Really a tragic, terrible, terrible. His investigation of what happened there and why this came to even be a possibility, that there was this connection between autism and vaccination. It's a very, very interesting episode. It was back in 2011, and I encourage, we'll put a link to it and listeners can find it. Okay, so that's measles and vaccination. Raw milk. What's the issue with raw milk?
So most of the milk that people in the U.S. consume is pasteurized, and pasteurization kills pathogens. It's a procedure that was developed by Louis Pasteur. It's also actually a miracle of modern science, because it allows us to transport and store milk safely. So in the sort of pre-pasteurization era, milk would be transported, fairly long distances without pasteurization, and it caused a lot of diseases. There were like large tuberculosis outbreaks associated with milk. And so there were, like, I think it is not an exaggeration to say that this also saved, many millions of lives as a result of having this pasteurization. Some people don't like pasteurized milk. They prefer raw milk. Raw milk has an interesting regulatory space in America. So you cannot transport raw milk, which is literally just unpasteurized milk. So think about, it comes out of the cow, you put it in a bottle, that's raw milk. It cannot be transported across state lines. So you can't milk your cow in Rhode Island and sell it in Massachusetts, but different states have different rules about whether you can sell raw milk at the farm, not sell it at all, sell it in stores. There's a variety of, the regulatory landscape is very complicated. When you look at the data, it is definitely true that raw milk is more likely to cause disease than pasteurized milk. So if you look at foodborne outbreaks of illness from dairy, they are disproportionately, relative to the consumption amounts, they are disproportionately in raw milk. And it's sort of clear why that would be. If you get, when you milk the cow, there might be poop on its, there might be poop around because there's poop. And that can get in the milk. That can cause E. coli. If you pasteurize the milk, that deals with that. If you don't pasteurize the milk, you may have that problem. So it's not surprising to learn that raw milk would cause more disease. Having said that, and this is the sort of nuance of the point, it's not that likely that raw milk will cause disease. So the risk, if you count up the chance and number of cases and how much foodborne illness we see from it, it's not a spectacularly large number. It's within the kinds of risk numbers that people would take in other aspects of their lives, some people. So if you said, is it a crazy thing? Would only a crazy person drink raw milk? I don't think so. Is it the safest form of milk to drink from an illness perspective? No. The safest form of milk to drink is pasteurized milk, and that's why that's most of what we sell. But I think there's a sort of, and this is kind of the point I was trying to make in the Times essay, I think to tell people that choosing to drink raw milk from a local farm is just as problematic as choosing not to vaccinate your kid for measles. I don't think that those things are kind of comparable in the quality of the evidence that you'd be basing that on.
And I think I think there are advantages to raw milk in cuisine. I think
I
you
don't
can do
think so.
things.
But
No, I think you can do
I
things
think
with
so.
raw
This is
milk
a little
that you
like people
can't
tell you all
do.
kinds of stuff about raw milk. It is this feature and that feature. I don't think those things are real well supported in the data either. Some people, I mean, maybe this is what you're saying. Some people like the way it tastes more. And so I think it does taste different.
No, I think what I'm saying, and it could be false, and one of the lessons of this conversation for me and in our world generally right now is it's really hard to figure out what's true.
Yes.
It's always been true in human history, but there's a certain aspect of that in modern times that is especially troubling, and that's because a lot of people yell on both sides of many issues, distort, fail to use nuance, sometimes lie, and as a result, you can't just say, well, I'll look this up, because you can't. You can look up a lot of yelling, and then you have to decide, are the people yelling, which one's more reliable? You can sometimes look at the data yourself, but it's a very strange world that we're in right now. The thing I was told, and I might get this wrong, so again, listeners, help me out, is that you can't make clotted cream from pasteurized milk. It has to be raw. And it may be just a matter of degree. It's easier or harder. But there are countries where you can buy raw milk and it's sold and it's not a big deal. Is that correct? The last part, at least?
Yes, there are many places where people sell raw. I mean, most of Europe, you can get raw milk. Yeah.
And you'd think, well, they're cautious. So what do they know that we don't know? And the answer is, well, this could be traditions and cultural reasons, and they love clotted cream or whatever it is, or whatever is the real reason cuisine-wise, right?
Yeah. And I think that, there's something that you gain by having some nuance here, which is this sort of ability to make it clearer to people what are the circumstances that would make this. If you said, this isn't the quote safest choice from an illness standpoint, you could, if we totally dismiss the concept and say, well, this is incredibly dangerous and no one should do it, we sort of miss the opportunity to explain to people, here are some things you want to be thoughtful about. You want to get this from a trusted source. You want to go to a farm where that they're washing things correctly before they put the milk in, and those kind of lessons are not really possible if we're not communicating in a nuanced way.
And we have to confess that we're economists, and
True.
We love things like this. We love nuance of, well, if you do this, then the risk is higher by this amount. And a lot of people don't like nuance, period. They just want to be told the right thing to do. And of course, we believe, I think correctly, that there are no solutions, only trade-offs. And telling people the magnitude of the trade-offs is not always what they are interested in.
Yeah, and I mean, this is absolutely right. And I think it's something that I struggle with because my whole brand and feeling is we should be more nuanced. And I do very much take the point that, some people would just like to be told what to do. I continue to think we spend too much time with the view that everyone wants to be told what to do, in a world in which people are doing, their own research, which they are. Not all of them, but some people, many. A good chunk, more than used to, are doing their own research, whatever that means. And in the world in which people are doing their own research, you need to give them information to help them do that smarter, right? And I think that's just the reality. We have to, as in public health communication, we have to respect the fact that people are looking into what we're saying and they're trying to figure out what is the right thing, and giving them better information to make that choice is part of the job of public health.
This is the motto of this program, in some senses, it's complicated, which is the essence of nuance. Having said that, I think about my own decision-making here as president of a college in Jerusalem, Shalom College, and sometimes nuance just doesn't help because you can't quantify these things reliably. And moreover, when you do quantify them reliably, you still have a hard choice to make sometimes. I tend to worry most about downside risk if the upside risk is small and the downside risk is great. I'll say no to a decision. But I'm just wondering if that's my pitiful human frailty and having trouble with nuance. You know, it just makes it easier for me, maybe.
No, I don't think that. I mean, I guess the way I would see it is I think that that if we're going to encourage nuance and thoughtfulness in decisions, we also have to help people think about priorities and sort of what decisions are really worth, like where there's a real trade-off or there's a real kind of either a very complicated upside downside or, a very big, small, maybe a small probability, but very big possible downside. Like, what are the choices that we actually really want people to be able to engage with them, where it matters a lot for either themselves or for public health, what they do. And then what are the choices where it's not that important. And so it's not like we could tell people, here's what we recommend, here's what we don't recommend, but we don't want to have that be the decision they invest a lot in. Let me give you an example of this. So I do a lot of parenting stuff, and I talk to sort of pediatricians about how, how we're communicating to parents. And one of the things about being a new parent is you get parents are looking to do the right thing. That's their main thing. And there's a tremendous amount of advice and things you're told where, you're sort of told what to do. And some of those things, it's actually pretty important to make, or at least there's a lot of evidence that one choice would be medically a better idea than another, for example, vaccines. And then there are many things where the pediatrician may say, here's what I recommend, but actually it really doesn't matter. So starting solids, should you start with purees or baby-led weaning? This is a thing that comes up. Should you give your kid purees? Should you give them solids? It's really not important. It's whatever, both are fine. And so often pediatricians will be like, this is what you should do, because they think people are looking for an answer. But actually, that's a place where it's not so much that you want nuance. You just want to say, here are the two choices. Either is fine. Just pick one. If you want me to tell you which one to pick, I'll tell you which one to pick, but it doesn't really matter. And then get them focused on if you really want to dig into something where you want to make a nuanced decision, here are the actual important things to think about. Here's a bunch of stuff you really just kind of, anything's fine.
Yeah, I think it's a great point. There are many areas of life where the way I would describe it, the stakes are small.
Yeah.
So even if one decision is wildly better than the other, the impact is not very large. And so you really shouldn't sweat that small stuff. You should just let it go. Make a decision. Don't worry about it. And there are many places where it's very large. The outcome's very large. So if you're choosing between where to go to trying to decide where to go to college, yes, your life will be radically different if you choose one over the other, but it's impossible to know which one of those is better for you. But academically, you might have some idea, or a subject you're particularly interested in, but I think it's very hard for people in those situations because they do realize there's a lot at stake, and the fact that they don't have any information about what the difference, the outcomes is going to be is very hard for humans. But I think your point's exactly right. Let's go to the third issue, which is kind of shocking to me, how this has come into the public discourse, which is fluoride. Talk about it.
So I think of these three examples, fluoride is by far the most complicated on a bunch of dimensions. Partly the data is hard to understand for people, and partly the whole conversation is very complicated. But let's sort of we can back up and sort of parcel it out a bit. So in general, fluoride is good for protecting your teeth. So if you ask, what do we know about fluoride? In general, these fluoride rinses, fluoride toothpaste. There's a lot of evidence that prevents cavities in kids and in adults. And cavities turn out to be bad for you. They're bad because your teeth hurt and you need, but actually they're kind of broadly bad. They're it's not good for you to have a lot of untreated cavities. So in order to address the sort of inequity of access to fluoride, there has for a long time been in many places in Israel, also in the U.S., most places in the U.S., there's municipal water fluoride systems. So fluoride is added to municipal water supplies so people get access to fluoride with the hope that will improve dental health. The evidence supporting the kind of improvement of dental health there, I think, is kind of reasonably good. Actually, some of the best evidence comes from Israel, where you stopped putting fluoride in the water, and then a lot of people got, like, a lot more kids had bad cavities. So we sort of see some, I think, reasonable quality evidence, especially with the existing knowledge about fluoride, that actually, like, this approach improves teeth, improves dental health. The concern that people have is that fluoride in water can cause neurodevelopmental problems when consumed by pregnant women and to some extent by kids. That, like, fluoride is a toxin that affects your brain. And what's hard about this is it is true that at very high levels, that's the case. So there are places, mostly China, India, where the, like, groundwater fluoride levels are very high, like 5 times as high as what you'd see in municipal water supplies in the US. So not like just a little higher, but much, much higher. But there you do see kind of at those levels, there's some evidence of negative impacts, not like spectacularly large, but there's some neurodevelopmental stuff that you're seeing. We don't see that in the data that looks at fluoride levels that are closer to that are sort of what we see in the US. But that's where in some sense, like, that sort of takeaway, if you're a person who spends a lot of time with data, is like the dose matters here. That, like, at low doses, this seems to be good for protecting teeth and doesn't seem to have any negative effects. At high doses, it seems to have negative effects. But then you're kind of having an argument or a discussion about, like, what's the right dose? Like, what's the point at which it becomes too much? And that's actually a really hard, nuanced question. And I'll give you, like, one example of why this is so hard. So somebody wrote to me the other day, and they were like, what about this study? And this was not like just somebody, this was like a reporter from a major newspaper. Like, what about this study that shows that concentrations at this level, which is the same as the level in, the US water supplies, shows that that's negative. And I, like, opened the paper and I was like, well, this is not measuring the water supply level. This is measuring, like, the urinary fluoride level, which turns out to be basically like half of the water. So it was like something was so in the weeds about, like, how are we measuring fluoride in these different studies? And that's where I think you get into trouble, where it's actually very hard to communicate nuance because there's so much nuance, and, like, we cannot possibly expect everybody to be, like, an expert on the difference between municipal water fluoride levels and urinary fluoridation levels. Like, that's just like a weird esoteric thing that people don't want to invest in. And because you can't say fluoride is totally fine at any level, and because it's also clear that it probably is fine at some level, we're kind of arguing something in the middle that's tough. And I think that's why this conversation has gotten so confusing.
What's fascinating to me about this is that when I heard that Robert F. Kennedy Jr. was saying something about fluoride, whatever it was, whatever the statement was, didn't matter. It was taken out of context and almost certainly to suggest that he was crazy. And I thought, fluoride, come on. When fluoride was first, meaning that's absurd, that's crazy.
Yeah.
When fluoride was first starting to become prevalent in the United States, I just looked it up. It started in Grand Rapids, Michigan in 1945. By 1960, most cities in America had fluoridated their water. I do know that at the time it was a big issue about, there are people who claimed it was a communist plot. It probably wasn't a communist plot. But there was something considered un-American, and this is a really interesting issue for me, in forcing everyone to consume this, regardless of whether it's, quote, safe, generally a great deal for your teeth, and so on. And a lot of people just felt, well, you shouldn't be forced to do it. And I think we'll come back in a little bit and talk about COVID, but I think part of the challenge, I think, culturally for Americans around COVID policy had to do with this. It was like, well, I don't think we should force people to do certain things. Now,
Right.
We make exceptions. I think most people, other than the hardest core libertarians, are in favor of seatbelt laws. Many of my friends are not because they're hardcore libertarians. But most Americans think that's fine because that's a good idea. But fluoride, partly because you can't see it, partly because it's part of conspiracy thinking, and generally you would do something with a nation's water supply, seems different. So that was my background for this moment
Yeah.
when I saw that he was doing this. And then I found out, to my total surprise, that many countries don't fluoridate their water. It was like, oh, well, that's interesting.
Yeah, I think it's not. I mean, so when I wrote this piece, a number of people were like, accused me of sane washing RFK. And I think many of the things that RFK Jr. has said are really do not make any sense. And
it's not the topic of this conversation.
Not the topic of this conversation.
His sanity, but I allow you to make such a correction if you feel the need.
But I do think in this case, my belief, having read the data and thought carefully about it, is that we should be fluoridating municipal water supplies, in part because I think that actually the people who would suffer from taking it out are largely the most vulnerable individuals, because people with good access to dentistry, people whose kids are going to the dentist all the time, they're going to get these fluoride rinses. There's other ways that they're getting fluoride. The value of putting it in the water is that it enables it to be available even to groups that are, otherwise not getting as much access. So I think it's a good idea, but I do understand why people want to talk about it. And I think that's kind of I don't know, that's just a tension.
I think it's kind of ironic that in Europe, where we generally think of it as much more of a nanny state than the United States, and where individual freedom and living on the frontier is not so big, but as it is in the United States, they let their people drink. A lot of countries let their people drink raw milk and drink unfluoridated water. The teeth are worse. Yeah, well, yeah, you got that. Although what I'm curious about is in China and India, where they're that five-fold thing, do they have fabulous teeth? Are they,
I don't. I think it's true. I think there's a limit to how much fluoride you need to improve your dental health.
I wonder if they get other effects. Okay, we'll save that for another episode. Before we move on to some general issues around this, let's talk about nuance in general. Why is it important? Coming back to an earlier point, isn't it dangerous? I mean, you have people who are not sophisticated now they think about risk. Isn't it better to just tell them not the whole story?
So I often think that if people were robots, that view would be fine. So if your view was basically the way that people are reacting to information is that they hear what you say and they do the thing you said, and in a world which everyone is the same, the kind of view has the same preferences, it would be fine to just say, here is what we advise. And let me so my husband has some academic work on this where they sort of think about, in his case, he's thinking about how should you show data to economists? How much should we sort of express our results as either the answer is 2, or here are all the data points, where in some sense you could ask that question if you're people are really economists here, why is the bin scatter so great? That's that's the source of the question. But what is the amount of information we want to provide people? And I think that their key insight is that it matters a lot whether everybody has the same preferences, everybody's sort of interested in doing the same thing with the data. In a world in which people's preferences are heterogeneous, which I think is the world we live in, then it's already a little tricky for there to be one piece of advice. Even if you thought everybody was going to do it, you might actually get it wrong on average. If you said, I'm a public health person, I'm going to take my preferences, apply the data to my preferences and tell you what to do. Well, if you're not the person with my preferences, that's going to be wrong. I think that's one problem. And that's one reason why Nuance can help people. If we sort of explain, here are the costs, here are the benefits, they can kind of combine that with their preferences to think about the right choices. I think the second piece, which is probably more practically important, is that people aren't going to listen to you. So if you say, you have to do this. So, okay, here's an example, Russ, co-sleeping. So in the US, we tell people, do not co-sleep with your baby. It's very dangerous. That's the sleep advice.
Meaning,
do not co-sleep.
Don't put them in the same bed as you.
Don't have your baby in your bed. Don't have your baby in your bed. It's very dangerous. That's a very clear piece of advice that everybody gets. Co-sleeping is incredibly common. Many people, very high shares of people co-sleep with their babies, and that's for a bunch of different reasons. And so that advice, you could say, well, we just want to give that advice because that's the best advice. But the thing is that people aren't listening to it and they're doing something else. And then you've lost the opportunity to explain to them, say, what's a safer way to do this, or to give them some more context for what circumstances might make this more or less risky. You've basically made the outcome worse by trying to tell people, do this, or in this case, don't do it. And then they don't listen, and then they do it in a way that is less safe. So I think that Nuance can be an opportunity for us to help people make the best choices, even if those best choices aren't the first best. Like it's like a way to help people make a second best choice. But the flip side of that, and I think this is important to acknowledge, is that if you introduce this nuance, there will be some people who behave in the way that you don't think is the right way. So if we say, generally we don't recommend co-sleeping, but if you're going to co-sleep, here are the safest ways to do it, you are probably going to get a little bit of an uptick in the number of people who are co-sleeping. And you need to trade that off with the fact that everyone, or that people will be doing it in a safer way, and that has some benefits. And again, we're economists, like we're very comfortable with the idea of kind of there are risks, there are benefits. This is not necessarily a Pareto improvement. I think that that's much harder sometimes in public health.
But do you think, I really don't like the idea, and of course I'm probably in a minority, but I don't like the idea of public health officials making those trade-offs for us, partly because of what you said earlier. We have different preferences. The idea that they would try to figure out how many people are going to ignore the advice now that we've said it's okay if you do it this way, and then they don't end up doing it that way, but they just feel they've gotten a blanket permission. I just don't think that's the right way for public health officials to make the decision about what to say. And my argument would be, and I know you're aware of this, is that the destruction of trust in expertise is mainly a bad thing, I think. And the last few years have done incredibly devastating damage to the trust that experts have from the public. And part of it is because they lie. They make statements that are not true, that either ignore the nuance or hide their own stake in it, or et cetera. So I just think it's really important to just tell the truth, even if you don't like the consequences.
I think we also erode trust. I think there's a sort of truth piece, but I think we also erode trust by not explaining uncertainty. And maybe that's part of, that's part of what you mean. But I think, in this kind of messaging, very, very, very unwilling to say, like, here's what we know now. And, here's what we don't know, and here's how we hope to learn it. This came up, and we talk about COVID if you want, but this came up a lot in COVID when information was coming out at all times, and the public health officials were changing their advice quite frequently, but never really explaining why, what new information did you learn that made you do this? And that's a way for people, that kind of not explaining, changing your mind without explaining is really a way to lose people's trust, because they're like, you told me to do a thing before that turned out to be wrong. Why is this thing right now? And I think that's, if we had said, we're not sure, here's how we're going to learn about it more, and we'll come back and tell you later what we've learned, and maybe it will change. I think that would have been a way to pull more people along.
And to be fair to the people in those situations, some of whom I have little or no respect for, but others I am quite aware of the challenges of the job. Say we're going to, we'll just explain it. We'll tell the truth and we'll just explain it. People's attention spans are short. Some of the explaining requires a level of sophistication that listeners don't have. And I don't want to pretend this is so straightforward. It's not.
I agree. I think it's hard, but I also think that explaining is a skill. And it is something that could be developed and invested in. And one of the pieces of, the advice, if anyone were ever to ask me, what would you have public health invest in? I think one of the things I would have them invest in is this kind of translation and explanation? How can you make it vivid to people? How can you explain uncertainty? How can you help them understand data? That's not magic, but it is hard, and it's a different skill than producing the research. It's explaining the research. And I don't think it's crazy to imagine that being something that, public health authorities invested in learning more about and figuring out, what resonates with people. Do they like graphs? Hope so. Built my whole life out on that idea.
Well, not only did the spokespeople need to be trained, but the listeners, the public, could be trained.
Totally.
There was an enormous fad. I don't know if it's still going on, but there was an enormous fad in teaching statistics to high school and younger children. Well, understanding uncertainty is probably one of the most important things we don't teach. Teaching statistics is not the way to get people to do that, unfortunately, because of the way it's usually taught, which is the application of combinatorics and then some definitions about what's
the mean
and the median, the differences. Those are all somewhat variable and somewhat useful, but they don't give people the sophistication they need how to think about uncertainty and risk. And that's in many ways maybe the biggest hole in education. So that's a topic for another conversation.
I totally agree. I think, in fact, we way underestimate how much kids could learn this stuff. I think I have a talk I give about where does data come from, which is about how do you, I start with how do we know what share of people in America are overweight? People are like, well, we weigh them all. Well, that can't be right. How, and then you sort of dive into it. And I've given a version of that talk to 11-year-olds and to the Brown Corporation. And it's you can give that talk to 11-year-olds. They have great ideas. It's well, how would you figure this out? Somebody's well, how would you get 30,000 people? Would you weigh people at a football game? And someone else is well, that's stupid. Those people, those are a particular kind of people. And you're yeah, okay. So, you can sort of bring people along there. And that's something actually kids are really good at, sometimes better than adults.
Yeah, I've thought about teaching an economics class that just starts with the question, are we better off as a country than we were 50 years ago? And how would you know? And when you start to think about how hard that question is to answer and the number of pieces involved, it's very informative. I think it'd be a good class. Yeah. But anyway, I want to apply some of what we're talking about to COVID. We did an episode in November of 2020 about the decision to close schools during COVID. It was a very contentious time. And to my surprise, maybe, but maybe not, it's still a contentious time, November of 2020. People have not come to a consensus about what we've learned in the aftermath. But I wanted to start with the question of what you think we've learned since then. You were very brave. You came out very strongly against closing schools. You said they were not super spreaders. You based this on evidence. Has anything that you have seen since then changed your mind? Do you have any regrets? What are your thoughts on that?
Nothing that I have seen since then has changed my mind. I wrote that piece with the title "Schools Aren't Super Spreaders" in October of 2020. And I think that basically all of the, we were basing that on some data from Europe, some data we'd gotten from the US, some of the early, just basic early observations about what was going on in schools that were open. Subsequent data, some of which was from us, some of which was from, more careful, complicated studies, basically completely proved that out. Not that no one ever got COVID at schools, but that particularly in that first school year when we were not, when schools were closed, the schools that were open did not spread a lot of COVID. So I think on that, I just think that the data ended up, the data we had at that time was supported by all the other data that came out later. The thing that even for me has been surprising is how problematic the school closures have been long-term. So looking at, what were the downsides for kids, part of the reason I pushed this so hard in October of 2020 was it already seemed to me like this was really going to be very bad for kids and bad for their learning and probably bad for many other things. I think that's proved to be right. I've continued a project in the sort of wake of the pandemic about kind of what's happened to test scores. And test scores every place, but especially in places that had closed schools, took an enormous hit during the pandemic, and they basically haven't recovered. So like they're crawling back, but we have not seen a recovery. And it's now, many school years from then. And I think that there are cohorts of kids who are going to be affected forever. And so I just think this was an even bigger mistake than I thought it was at the time. And I think by and large, people have come around to that view. Certainly relative to the amount of, hate I got in October of 2020, I think there are many more people who would now say, well, actually, you were right.
You still get a lot of hate.
Sure.
I don't know if you look. I looked for about 30 seconds. I don't know why it came up. I saw something you had said or you were quoted or it was on Twitter, and I was shocked at the vitriol directed at you, and I feel bad for you because, as I said, I think you did something brave. It didn't have to be that brave. People have very emotional, partly ideological issues around partisan politics on these issues, and the response is not really a careful look at the data. It's not very nuanced, the response to your work.
I think that there's a sort of there's a sort of far left contingent on this. Look, I make people angry on all sides of the spectrum. It's one of my special talents. But on the particular issue of school closures, yes, I think that there's a set of sort of people on the left who still feel that school closures were a good idea, maybe that they should have been closed longer, that if only we had shut everything down and done nothing, no one would have gotten COVID. And I don't think the data supports that. I also think that position has become more fringe. And for me, kind of part of what was tough in the early parts of this were many people thought that this position was crazy, like government official, like this position of we should open schools was basically something that like a huge share of people were like, you're not right. Not so much on the right, but a huge share of the left, center left, thought that this was not true. I think that has become much less true. Many people who at the time said, you're wrong, have now kind of come around. You're always going to have, whatever. There's always going to be people who don't like me. It's okay.
Well, I think the part that's interesting is, as an economist, is that I remember that debate very well. And I reveled in it a bit because it was a wonderful example of how economists understand some things that are not well understood. When I would argue that we should open the schools or that we shouldn't mask 4-year-olds or 3-year-olds or 2-year-olds because it had consequences for their ability to interact with other human beings, people would respond to me and say, but this is life and death.
Right.
This is, you can't equate having healthy social development and healthy educational development with children dying. And that's true. They're not the same. At the same time, an economist is kind of acculturated to feel that there is some amount of social dysfunction and some amount of educational disaster that is not worth enduring, even if some lives are saved, because there's an enormous value to those things that are lost, and I can't measure them and equate them and then do a cost-benefit analysis. Some economists can and think they can, and I think that's wrong. But just the very idea that you would risk some death to save a generation, say, from social dysfunction was considered insane. How could you make that trade-off? But economists do it very easily, and it's interesting. A lot of people didn't, and that's fascinating.
Yeah, no, and I think it really sort of illustrated like that way of thinking, that there are trade-offs and that you would want to think about the sides of the trade-offs. And in this case, think about the educational, costs, and think about how those are spread across, social groups and whatever it is, like that there would be trade-offs. That idea was just not, that was not, there was a very clear, almost like lexicographic view that was like, if one person got COVID at school and died, it would not have been worth it to open schools for everyone. Right. Yeah. And I think at some points I got the sense that like, that's kind of what people believe, that if I told you 100%. I can open the schools, I can open all the schools 100% and give kids exactly this, but like one additional elderly person will die, they would be like, that's not worth it. And I think that's a kind of view about this that like one could have, but it isn't the view that I had. And I also think it would have been useful to sort of say, well, that's how we're thinking about the trade-offs. This is not, the other thing that I found really complicated and problematic about this was, there was a kind of component of this, which is, you're trying to hurt, poor families who are like going to be the ones who are, most likely to have COVID. The answer is like, those kids are also the ones who lost the most. They're the ones who are the most likely to have school closures, and they lost the most from school closures. Like this was not a simple thing. And, the other thing I'll just say on the personal level is people would, at that time, a lot of people were like, you just want your kids out of the house. Like you're just advocating for open schools because you don't like having your kids around. And I wanted to say, look, I am a person with resources. My kids go to private school. They were in school September 4th, 2020, in school 5 days a week for the entire year. Like if I'm not doing this for my kids, first of all, yeah, I didn't want them to have them in my house, but I love them very much. I just thought school was a better place for them. But this was about advocating for people who didn't have those kind of resources, not advocating for something personal. And I thought that was a very frustrating interaction.
Yeah, that's an incredible story. I think about people who made the argument that, if we send the kids to school, they'll get COVID. It's true. They're not very likely to be harmed by it because we found out fairly early on that this was a very different disease for the young versus the old. But they're going to kill their grandparents. They're going to go home and kill their grandparents. And the idea that we should make public policy based on that ignored two things. The possibility that we could tell grandparents that their children might be more risky to be around. But more importantly, most grandparents don't want to punish their grandchildren by having them have a terrible educational experience and social dysfunction because they're looking at other people with masks on all day. And the idea that we should make that decision for them, coming back to our earlier discussion, I found, very sad. There were many times during the pandemic where people would say, oh, so-and-so, we shouldn't have this event because there'll be old people there. And so you're telling people, or we should have the event, but old people can't come because it's more dangerous for them to this wedding, say. And you're telling a person who's 84 years old, guess what? They're going to die. They're going to die with or without COVID. And you're telling them they can't enjoy this moment that's precious to them. I don't know. I feel like we went in partly, kind of insane.
There was this moment for me, Russ, in the spring of maybe in May or something of 2020, where I was writing a lot about, grandparents and daycare and this trade-offs for people. And I got an email from someone. It's still, when I think about it, basically makes me cry. And it was from a grandma. And she said, she was like, I need your help. Before COVID, I was spending a week, a day. I have a 2-month-old grandson. And before this, I was spending a day a week taking care of him. And, now, and it was the greatest thing ever. And now, my daughter doesn't want me to see him because she's afraid that I'm going to get sick. And she said, I would rather die than not have this time with my grandkid. And this is, and it was just this moment, oh my God, this is this person's, we are really missing something if we think it was just a moment of we're really missing something.
You're not a grandparent, right, Emily?
No.
I am. When you're, God willing, someday you'll be a grandparent, a grandmother, and the story will make you cry even earlier in the telling of it.
Yeah.
Because I tear up just hearing it, and I didn't get the full text and have the emotional investment. And I really think a lot of this, we've been talking about lack of nuance. The death, no death thing, and forgetting the fact that we all die, it's really important to remember that. It's just a question of when. And the idea that you would deprive a grandmother, I understand why a daughter might be worried about her mother dying from contact with her grandchild. I understand that. But it's a selfish decision, actually. And it's hard to say that. It's a selfish decision.
It's interesting, Russ. I wrote to this person. So a couple of years later, I was just like, this is something, it's an email I think about a lot. And I wrote to this person, like, I had written back to her at the time. And then I wrote back again. I was like, I just wanted to know, like, what happened. And then it was very nice because she was like, yes, shortly after that email, my daughter relented because we needed the childcare. And actually it was totally great. And now we have another grandkid and everything. So it was like a very nice sort of, it ended up being very nice. But I think it was a sort of moment of realizing, like, that's a trade-off I want to make because this is, I don't know, because there's trade-offs.
Yeah. Before we leave COVID, is there anything, I mean, you were very involved in this issue of school closing and the issues we've been talking about, intergenerational impacts. Are there other parts of the COVID public health messaging that you think we really got wrong and need to learn something different for the next time? Or do you think, this was just an example of people struggling in uncertainty and making mistakes inevitably? I look back on it, and what overwhelms me is how little we've learned, and I think our partisan identities have greatly hampered our ability to learn lessons from this, and that's shocking to me. It's a health issue. It's not what normally would be a political issue. It shouldn't be a political issue. It's about human flourishing and safety and. It's weird. What do you think?
Yeah, I mean, I think we have not learned much. I think that there's, I continue to think the current messaging around vaccines around COVID vaccines needs to be a little more targeted. I think we're way underemphasizing the value for older adults of getting consistent boosters and probably overestimating the value to younger people at the cost. And the result is nobody's getting them. I think at the time, the conversation about masking was very complicated and probably, it probably could have been more nuanced. I mean, the policy, for me, the schools are the biggest policy failure, but that's partly because, like, that's the one that I was most, like, I know the most about. And so I haven't, and then of course the fact that, like, we failed to protect nursing homes, which were the source of, like, such an enormous share of the actual deaths. I mean, I think that was just like many terrible things happened there, which we could have focused more on.
Yeah. Let's close and talk about your new podcast, Raising Parents.
Yeah.
What's the idea?
So the idea is in partnership with the Free Press, and the idea is to talk about sort of some of these big sort of parenting issues that have been coming up in the last couple of years that people are hearing a lot about. Phones, should I let my kid out more? Why is there so much mental health issues with kids? Why are we feeding our kids? Why isn't anyone having kids? And to really the podcast is sort of like quite heavily produced. We talk to a lot of different people, try to get many different perspectives. We have an episode on discipline in which we talk to everybody from the kind of like gentle parenting, like never punish side, all the way to a guy who spanks his kids, and like sort of trying to understand the differences across those perspectives. And is there anything that's bringing them together? And, it's basically about perspective, I would say.
You've become a parenting guru, and maybe the most famous one in the country alive right now. There's some dead ones are pretty famous, but it's a great niche. everybody is thirsty for information, but it's a little scary. How's it feel?
It feels like a tremendous amount of responsibility because I want to help people make good choices, but also like huge privilege and like a very good use of my talents relative to what I was doing before.
My guest today has been Emily Oster. Emily, thanks for being part of EconTalk.
Thanks, Russ.
This is EconTalk, part of the Library of Economics and Liberty. For more EconTalk, go to econtalk.org, where you can also comment on today's podcast and find links and readings related to today's conversation. The sound engineer for EconTalk is Rich Goyette. I'm your host, Russ Roberts. Thanks for listening. Talk to you on Monday.